There are three main layers of tooth structure. The white outer layer we call enamel, and that covers the whole part of the tooth that's above the gum. That's very, very hard, has no feeling at all. It's kind of like our fingernail, hard but no feeling. It's actually the hardest substance in our body, harder than bone even, which is why in all those CSI shows they always ask for dental records. The second layer is more yellowish in color. It does have feeling, it's called dentin. And the third layer is the pulp chamber, which is the uppermost portion of the root canal system. So if there's trauma to the tooth or a cavity that works its way through the outer layer, through the second layer, and communicates with that third layer, which is where our nerve and our blood supply are, then the tooth can become infected. At that point, bacteria gets in. Once it's gotten infected, and now you're getting either an infection or pain, we've only got two solutions. Either take the entire tooth out, which will solve the problem because the source of the problem is the infected tissue inside the tooth, or remove the tissue inside the tooth and leave the tooth there. Completely disinfecting and sterilizing the inside of the tooth and leaving the remainder of the tooth structure, the remainder of the dentin and enamel intact, that procedure is called root canal therapy or endodontic treatment. Endo means inside, dental tooth, so endodontic treatment is inside tooth treatment. Once you've removed the source of the infection or pain, then the tooth can continue to function like before without the pain. And then you just need to restore whatever tooth structure has been destroyed or missing from a cavity or trauma. Root canal treatment is often considered when people are in extreme pain. It might be extremely sensitive to temperature, hot or cold, or they can't bite on it, or the tooth, they've had a toothache all night. But obviously dealing with the pain is something that is of high priority, and root canal treatment is designed to get rid of the source of the pain. So removing the infected tissue from inside, either from deep decay or trauma, those are reasons why you'd get a toothache, and root canal therapy is supposed to help solve that problem by getting rid of the toothache and still having the tooth still there to function afterwards. So high priority, get rid of pain, and then rebuild the tooth after. Those are the reasons why we would consider having root canal treatment done.